Hi, I'm Ben Munson. I'm the editor at Medical Design and Development, and I'm here today with Allison Harbaugh, the medical business manager at Stratasys. Allison, thanks for joining us.
Thanks, Ben. I'm glad to be here.
Absolutely. Could you start with a brief overview of what Stratasys is doing in the medical space?
Well, the truth is medical space is so broad. So it's a big aspect when it comes to our support to hospitals and medical training facilities, along with medical device companies. So whether we're helping to create prototypes, tooling, jigs and fixtures, marketing samples, or if we're supporting surgeons when it comes to creating surgical planning models and simulation tools.
Absolutely. It is, yeah, it's a really broad subject. So why don't we kind of drill down into one of the more specific projects? I think last year, Stratasys began a study using 3D printed models for orthopedic oncology, specifically like pre-operative planning and tumor excision. Can you talk a little bit more about how that study is going?
Yeah, sure. So the study that you're talking about is a multi-site study that's being run by Ohio State University. And so at the moment, we are about halfway through the patients that are being selected for the study. And so these surgeons are utilizing a blind study for, obviously it's a surgeons know if they have a model, patients don't. But they're going through a blind study to be able to assess whether or not having patient-specific models that demonstrate where their tumors are in different oncology situations to see if it's supporting, surgical planning. Maybe it's helping accuracy, maybe it's supporting OR time, maybe it's helping patient recovery, all of which we hope to be able to hear and read about soon. So the study is still ongoing that I can't share any of the current outcomes, but the goal is to have it released by the end of the year.
Mm-hmm. I would imagine that this kind of technology would not only be good for, preoperative planning and all the other advantages you mentioned, but also in communicating with patients prior to procedures.
No, I think it has a huge impact with communicating with patients. I mean, imagine you were told that you had a tumor in your kidney, and now you're only being shown by your surgeon a black and white image on the screen, which is pretty much like your MR or CT scan. And when you look at it, it literally is digital slices in each individual layer of your scan that was taken. And if a surgeon's going to go through that with you, it's probably going to just look like slices of a weird shape that's going on. And it's like floating in space and not really aware of exactly how that's affected you. And now you have a chance to take a model in your hand and really understand how large either that tumor is or what vessels are really close to it that might affect, the surgical approach or procedure. For a surgeon to really go through what their plans are, what your recovery would be like. I think it just allows that much more comfort and understanding for patients to understand what they're going through and what they're about to experience.
Yeah, I know you can't talk too much specifically about the study, but you have to imagine that the feedback will be positive. It just sounds like such a difference between what's available today.
I mean, I think our hope would be this eventually just becomes standard of care. It's not going to be the extreme cases. It's not going to be something that's very complex, something that's very rare, that it just starts to be part of like your standard order as part of your medical imaging is to be able to get a model and for surgeons to be able to visualize it differently, for patients to get a better understanding. And I think there's really a big part when it comes to teaching, especially with so many teaching hospitals, to go through that form of simulation and practice. I mean, if you think of even pediatric patients, that's a huge portion when it comes to training, to be able to train on simulated models, and get that chance to practice something that's so tiny and so small, to be able to own in on your craft.
Absolutely. Yeah, it sounds incredible. Another study you started, or Stratasys started last year, was on 3D printed regenerative breast implants, and I was wondering if you could kind of give us an update on how that's going and talk about the potential benefits of the technology.
Yeah, so this is something that's being pretty much a study, or all the work is being done by a company called CollPlant. And so CollPlant is looking to use a plant-based resin to create these regenerative, like tissue regenerative materials. And so they are looking to use, right now they've been working through with our Origin printers. So our Origin printers are a a DLP or a digital laser processing printing process. And it's an open source system. So if you were a customer to Stratasys, we currently have about 14 validated materials that you can go into our software and be able to use. But with CollPlant, they are taking their own material as part of the open source side of the system and creating their own parameters for printing. And they really like our Origin systems because of its accuracy and repeatability. And so they're going through the process of recreating breast implants that will become bioabsorbable. So as I said, they are a plant-based resin. And, you know, as someone who I would say like doesn't really watch much, or I guess I'd say stream most of my television these days, what really stood out to me, I don't know if you watch like between all the commercials you see at the Super Bowl or even the Oscars, but one that really stood out to me was your attentionplease.com commercial. And it was putting a lot of attention to breast cancer awareness, going through breast cancer screening. So I think a really positive side of what CollPlant is doing is giving women who do have cancer and have to go through having a mastectomy, like another option of how you can go through feeling like yourself again, having another material or form of an implant and reconstruction.
Mm-hmm. Yeah, it sounds like a really kind of exceptional technology, and I would imagine what they're doing could maybe have other medical applications, kind of working with with Stratasys technology, correct?
Yeah, so I think if you like even look through their site, it's almost like the start of a product to prove that this resin could be used for more applications when it comes to different bioabsorbable regenerative tissues.
That's really interesting. Before we leave, I wanted to ask you about DentaJet, which is another technology that Stratasys has been working on in the past year or so. Could you kind of take us through what that could mean for the dental space?
Yeah, so a couple of years ago, Stratasys released our J55 system. So it's a smaller polyjet system. What's great is it's similar to what we see in our hospitals, which is our J5 MediJets that a lot of hospitals will use. We have a J5 DentaJet. So it's dental specific materials. It's about the size of a single door refrigerator. And what's great is now we have a material that can be used for low impact dentures. So it's called TrueDent. And with this of being able to utilize our multicolor materials is now you can create models that will mimic, you know, the slight yellowish to your teeth. You know, you're no longer getting a denture, it's like stark white and looks unrealistic, or the true pink to your gums, and it's not like a bright pink and someone can tell that it's fake. What's also great is, you know, Stratasys has been releasing biocompatible materials for a long time, and these are considered class 6 materials. They can have, we call like mucosal contact or skin contact, but now with our TrueDent, if you follow our procedures and process, you actually are creating an official class 2 device. So straight off the printer, following our cleaning steps, you now have an official device that you know, these dental offices can be able to create, of giving you a, whether it's temporary or even permanent, but as a low impact denture that truly looks realistic.
Is that having a big effect on like turnaround time for these sort of implants?
Yeah, so like if creating a denture is going to take an extended period of time, like within, you know, like a day, patients can go home with a TrueDent, you know, or a low impact denture. So you have something already to use while waiting for your permanent dentures to be created.
That's amazing. Well, I don't think we have much more time, but before we leave, I wanted to ask you about the new ISO certification for your direct facility in Arizona. Can you just tell us a little bit more about what that actually means?
Yeah, so our Stratasys Direct, we actually have 3 facilities. So we have our Tucson, Arizona, we have Belton, Texas, and we have Eden Prairie, Minnesota. And so what has been really big with our ISO 1345 certification, and this is at right now our Tucson, Arizona site. And so at this site, we have our SLA printers and we have our Origin printers, and it's really showing our commitment to the quality standards within the medical industry. Now, all of our facilities are compliant to these standards. Tucson, Arizona was the first to get certified, and our other facilities will be certified by the end of the year. But it wanted to expand our quality standards. So for right now, aerospace, we follow the AS 9100 standards. Now this is our way of doing the same thing within the medical industry. So showing that we are following that quality, safety, and performance standards that are required.
Yeah, I would imagine that means a lot to your partners.
A lot to our partners, a lot to our customers. And so to really be able to help grow the medical devices that are out there by utilizing Stratasys direct manufacturing as a supplier to be able to create certain components.
Okay. Well, thank you so much for being here. I really appreciate it.
Not a problem, Ben. It was a pleasure talking to you.